Hello.
Hello. Hi, good evening.
Hi, good evening. How are
How
you?
are you? I'm doing good. Thank you so much for asking. How about you?
Yeah, I'm good too.
Okay. So, just give one second, please. So, okay. How was your day today?
Yeah, it was good.
Okay, that's good to know.
Uh,
Anything specific that you did today?
it rained a lot.
Oh, so
Yeah.
I'm so sorry. I must have asked this to you before also, but where do you live?
I live in Delhi.
Okay, so it rained a lot in Delhi today.
Yeah.
Okay, because it did not rain today here in Himachal, although it was raining like a
Okay.
lot since a lot of
Yeah,
days.
it's been raining. I saw in the news.
Yeah,
There's a lot of cloud burst and everything.
exactly. At least in my area, it did not rain a lot today, but it was raining a lot
Okay.
in the other areas. So,
Yeah.
uh, yeah, that's a new thing. Okay, so how are the conditions over there in Delhi? Because I
It's
heard
quite
that in.
okay. Here it doesn't rain too much. There is some water logging. Other than that, it's
Hmm.
normal.
Okay, so are you guys working from home, or are you still going to your offices to work?
Yeah, I'm working at home
Okay.
not for from home because I'm working on my own right now.
Okay.
So I'm just in the initial phase of my new project. So
Okay, got it. Okay, so shall we move towards the topic of today's conversation then?
yeah, sure.
Okay, so the topic of today's conversation is on homemade remedies. Are you comfortable talking about it?
Yeah, okay.
Okay, I'm so sorry. Can you just give me just 1 minute?
Hello.
Okay, so the topic for today's conversation is homemade remedies. Are you comfortable talking about it?
Yeah, I'm comfortable.
So, first of all, I would like to ask you the familiar question: how often do you fall sick?
How often? Like it's not uh, often.
Okay,
Yeah, it rarely happens.
okay.
Yeah,
When was the last time that you felt sick that you maybe remember right now?
last time. Yeah, it was in July.
Okay.
Yeah, I
And
was
what
having
was it?
stomach infection
Okay.
due to
Got
some food I took outside
it.
in the market.
Okay. When you fall sick, do you prefer to go to a doctor? Do you prefer to sit on it and wait for it to go on its own? Or do you try some homemade remedies?
So it depends on the situation. If I'm feeling pain or having some severe disease, then I have to go to some doctor. Otherwise, I wait for it to vanish out somehow by itself. Or if it persists for 2 or 3 days and it's mild, then I try some home remedies.
Okay. What are some home remedies that you know of?
There are many, like if I'm having stomach infection or some pain in that, then I try some powder, homemade powder. It depends on for what purpose it has been made. And other than that, for headache, I can try that Navratna oil and some other roll-on. Yeah, there is roll-on also for that. So it depends on the situation, what kind of problem I am having. For that, I have to go to doctor or to wait at home for it to go by itself.
Are there any homemade remedies that are like in your family for a long time? Like sometimes our grandmothers tell it to our mothers tell it to us. So,
Yeah,
are there any
yeah,
such remedies
yeah.
in your
Whenever
family?
whenever my throat is sore, like it's the initial phase, then I'm told by my mother, or my mother tell me that go and have some ginger and put it inside your mouth and just chew it a little bit and then for some time. So it's the basic remedy that I am hearing for a long time.
Okay. So you said my mother tell me. It should be my mother tells me, not my mother
Yeah,
tell me,
tells me.
because mother
Okay.
is a single word.
Yeah.
Okay. A lot of people are skeptical about going to the doctors. I've seen this paranoia when it comes to going to the doctors among people.
Yeah.
Are you among such people who are skeptical about or even paranoid about going to the doctors, or um, do you like trust doctors enough to go to them?
No, I trust, but first of all, I think about it whether it is a problem that can go by itself or not.
Mhm.
Like it will depend on the problem I am having. Like it's a headache, then definitely I won't go to the doctor. Or it was the stomach infection. It was so severe that I had to go 2 or 3 times to the doctor for the medicine. And I am of that type that if I get the medicine, I don't break in between. Like I don't skip it. I
Okay.
complete the course of two
Mhm.
days, 3 days, or 4 doses, or anyhow, whatever it is.
Okay, that's amazing. Yeah, because that's a really big problem that people do nowadays, which is like leave the medicine in between, or they don't
Yeah,
even
yeah,
take the
right.
medicine. So
Yeah,
that's really difficult then for doctors also, because that
yeah.
results in a lot of other problems like antibiotic resistance and so on.
Like it happens like when you are given 4 doses for 2 days, say,
Hmm.
and you feel relief in just one day, then you don't take the other medicines and you skip those, and then somehow the same problem may come again in some few next few days. So we should do skip the course. If it is given by the doctor, we should take at least them. If you don't even go to the doctor next time, but you should complete the course whichever was given for the first time.
Absolutely. But do you know anybody? Because I'm sure there are a lot of people around me as well who do not go to the doctors, absolutely do not trust doctors, try to go, even if they go to doctors, they do not want to go to the allopathic doctors. They'll go to the Ayurvedic doctors, the homeopathic doctors. So, do you know such people around you?
Yeah, I know many,
Uh-huh.
not even one. I know
Okay.
many of them. Yeah, they would first try Home Remedies, then they'll go for Ayurvedic, then at last, if nothing happens, then they will try for allopathy, otherwise, they won't go to them.
Do you think it is a healthy thing to do all of these
I
things?
don't think it is healthy. I think it will just increase the disease, and it will take longer to recover. Once the real treatment starts, it will take longer to recover because you have kept the disease to last in your body for a long time. So it will also take long time to recover.
Absolutely. And what is the argument that these people often give? Have you ever like tried to talk to them, and what is it that these people try to argue, and what in their mind is the thing that sort of validates this behavior?
Yeah. So most of the time they are afraid of the side effects of allopathy. That's it. That they don't want to take those medicine which may have side effect, or they don't want to even go for that. But they have this in their mind that yeah, definitely there will be some side effect, either on the kidney or on the stomach or on any part of the body. So they just want to try either the home remedies or the Ayurvedic one.
Have you ever observed any side effects of allopathic medicines when you have tried to have them?
I haven't, but there may be sometimes. Sometimes there may be such issues that the doctor was not efficient. So, and you have taken medicine from a local doctor, which is not a certified one, then there may be issues with any person. There may be some allergy because of some medicine. There may be some other issues like a headache or vomiting or stomach infection. Such issues may happen if you have taken medicine from some unknown doctor the first time you have gone to some nearby one just because of lack of time.
Has that ever happened to you?
I can't remind something like that, but yeah, I think never happened to me.
Okay. See, it should be I can't remember, not I can't remind,
Yeah,
because remind is
yeah,
when you like
remember.
make somebody else remember.
Okay.
Okay. With social media, I started seeing a lot of posts, and especially they are in case of metabolic disorders, maybe cancer or some like big disease, Parkinson's, cancers, and
Yeah,
so on. But people
yeah,
are claiming that this chemotherapy and radiotherapy and everything that we like the standard medicine for cancer is just a money making machine for doctors, and you don't need it. You can eat good food and you can reverse the cancer, and they say it so I mean, I am a medical student, and they say it with
yeah,
such a conviction that even sometimes I start thinking, and they try to give a reason behind it, which may or may not be true, but they do give. And then I recently saw a case where there was such mother who promoted. Hello,
yeah. I can hear you.
yeah, am I audible to you, sir?
Yeah,
Okay,
audible.
so there was this lady who promoted such like lifestyle interventions other than medicine, and
Yeah,
her daughter had cancer, and she sort of tried to influence her, and she got influenced. She declined to have the chemotherapy,
yeah,
and ultimately she died of cancer. And
yeah,
the lady's sons sued her because they lost their sister because of what she preached. Do you believe that when it comes to such deadly disease, you can cure these disease just based on medicine and not going to a doctor or without any medical intervention? Do you think it's a good plan?
No, definitely, I don't think it's a good plan because if you talk about a particular disease like cancer, if there had been some remedy, like you can do it on your own, then it would have been eradicated for past many years. But there is still no definite cure for this. If you can detect this in the prior stage, in the first stage or second stage, then you can easily get it out of the body. Otherwise, there are very less chances of the person can survive for long years or coming years. There is very less time for them to just recover or just to live your life. But some people try, just like you said in the example, or it was a real situation. So I think this is a bad idea, or you are playing with the life of a person with your own daughter in that case. So it's not a good idea to do this thing on your own and just to wait for something to happen miraculous.
Okay. That's absolutely true. I mean, sometimes you just have to accept that you do not know everything, and
Yeah, right.
doctors know it better, and you have to leave it on them.
Yeah.
On that note, what do you think about the Ayurvedic and the homeopathic treatment regimes? Do you think they're good? Do you think they have any effect?
See, they have effect, but they'll take a long time, and it will depend on what kind of disease you are taking those medicines for. Like you are having a hair fall, and in that case you cannot do something that it will stop immediately. In that case you can go for ayurvedic medicines. But if you are having some problem in your eyes and you are unable to read or you're unable to see properly and you are having pain, then you definitely have to go for the lasik, uh, what do you call,
The
um, yeah, you have to go to a doctor who is optical,
optimal.
what do we call that doctor, yeah, ophthalmologist. So in that case, you can't go for the Ayurvedic medicine and wait for a period of say years to cure. So it will depend on type of disease.
Absolutely. I mean, I think at that point of time, human beings should definitely use their brain and see if the
Yeah,
severity of the disease is a lot. You have to go to a proper allopathic doctor.
yeah.
At the same time, have you ever been to an Ayurvedic or a homeopathic doctor for any ailment, or somebody that has gone to these doctors and has it worked for them?
I myself went to a doctor who's Ayurvedic, and he gave me some tablets, and I took them for around 2 3 months or 4 months, I think. And I was having a knee pain at that time in both my knees. So I took those medicines, but I don't think there was some benefit to me, and I stopped after that time, and I went for something else, and after that I got results, and it was allopathy.
I think it also depends. For everybody's body is not same, so
Yeah,
something may work for me
body
but may
also
not
accepts
work
or
for you.
rejects some things. Yeah,
Absolutely. And then it also depends on the doctor, because one thing that I have learned about these treatment regimes is that although they might work, but the thing is that the doctors today know what are the ingredients used. They do not
yeah,
know how much of that ingredient needs to be added in a
yeah,
single
right.
tablet for it to be effective. So, because there's a lack of literature on that, some doctors just sometimes make it and they end up adding it in the required quantity. Sometimes they fail it, so some doctors may work and some doctors may just miss the mark,
Yeah, right.
and it may not work for you. But yeah, but it may or may not work for everybody.
Yeah, right.
uh, Anyhow, to what extent do you think we can trust the home remedies? And as you also said that you're somebody who would first of all try to wait for a period of
Yeah.
time to see if the problem persists or if it goes on its own, then you try home remedies and ultimately you go to the doctor. Where do you draw the line? Where and how do you decide that okay, now it's not going away on its own, so I need to see a doctor for it definitely?
Yeah, it will definitely depend on how longer I can bear the pain. Bear the pain. So If it's mild one, I can wait for a week or maybe 10 days or 15 days. If it's a mild one. If it's severe and I am unable to uh, wait for 1 day or 2 days, then I will definitely have to choose something immediately, that I want to go to a doctor and I just want this cure to be done immediately on me. So it will depend on what kind of pain I am feeling right now.
Okay. With doctors also, people have started having second doubts, and rightly so, because this has become a business. So basically, a very good business model. Because now even a lot of doctors have come out and have openly said that we are given targets like corporates to get this many OPD patients into surgery, and
Yeah.
if we do not fulfill the targets, there are some repercussions that we have to face. So what do you think about that? Do you think in today's scenario, you can just go to a random doctor and trust whatever he tells you, trust his diagnosis or his advice, prescription?
Uh, Whenever we are sick or our kid is sick, a little one is sick, we first of all we consult or we advise, take advice from our friends or family members that which doctor should we go to, or they have some experience of any doctor that we went to this doctor and then the medicine worked so good. So after that we will decide whether we want to go to that doctor or not. So just trying a doctor for the first time, we can take that situation on us, but not for someone else. Yeah. In especially in case of kids, we don't want to go for a new doctor, a random one. We first take
Yes.
advice from our friends or family members that do you know some good doctor of kids. So then after that we decide that.
Okay. You know, as like I've grown up now, and when I have come to my senses or I'm like responsible enough, I'm seeing this scenario where
Yeah.
maybe if you do not know a doctor, you cannot trust them. But
Yeah. Right.
was it similar earlier also, maybe like 10 years back? Was this the scenario or were the conditions better?
I think the scenario has been same, that there were some family doctors also for a family. There was a common doctor that they will go to the same whatever happens, until and unless there is some surgery has to be done, and that cannot be done by that doctor. You have to go to a hospital. So the situation was same, but maybe so because of some issues, for the last time the doctor was unable to cure the person in the family, and something else happened. Then they'll go for someone else the next time. Otherwise, there has been a common doctor for a family. Like we are also going to a nearby doctor for last say 20 years for the small diseases or the less severe ones. Otherwise, we are also going to hospitals for some severe problems. So the
That
situation
I
was same.
understand, that like everybody has a family doctor, that even
Yeah,
like we have a family doctor, and because
yeah,
we live far away from them, but we discuss everything on the phone with them. But
yeah,
I understand that there were these doctors always who would give you like 10 tests if you just need one, just because they get some
yeah.
commission
Right.
from these tests.
Yeah,
But I don't think that the doctors actually recommended surgery to people when it was not needed. But now even that has started happening. For something that you do not need a surgery, just doctors recommend it because, as I told you, that they're given targets that you have to convert
yeah.
this many OPD patients into surgical patients. So do you think that's a new thing, or do you think that was always happening as well?
Yeah, it is happening a lot nowadays. Like recently, I went to a doctor for my stomach infection. He told me few tests for that infection. He told me to go for some tests, and he also told me the price instantly, that this much for this test, this much for that one, total will be this one. In the evening you come for a sample, and tomorrow you will come with the reports, and then I'll show you the and prescribe you the new medicines. Even when that disease can be cured by a single day medicine, and it has happened earlier also, but now the doctor has changed things. He has changed his criteria of dealing with the patients. He has started his own lab just besides, and he's taking the samples and getting them tested from somewhere else, and he's making the reports there. So he want to promote that you have come here. I'll take your sample right now, and in the evening you can get the report. And so he's incorporating these things to with every patient, whether
So that
he's
has
requiring a
happened
test or
everywhere.
not.
That has happened with me as well. During COVID, all
Yeah,
of us like got sick because we had some again stomach infection. Maybe it was an E.
yeah,
coli infection or something, and the doctor gave us like so many tests and
yeah,
ultrasound. That was the first time in my life I got an ultrasound done, which was not needed, but to everybody in my family, like everybody went in, they wrote the same set of tests to everybody. And that happened to me once when I was in the college and I was a student. I went to a clinic, a retired couple ran that clinic, and there was a typhoid outbreak at that point of time in the area. And my symptoms were also persistent of typhoid. My father, who's not a doctor, told me that it is a typhoid. But instead of just testing for that, they wrote me a test for sugar, a urine analysis, and whatnot. And they could clearly see that I was a
right.
student. And you do something for a student, they don't have that kind of money. But anyhow, I got all of those tests done. In the end, it was just typhoid. But yeah, you can never say no to a doctor because then otherwise,
Yeah, if,
you never
if
know.
just a similar case, if I tell you that recently one of my family member was sick, and for that we had to get him admitted to a hospital. And before admitting, one day prior, we had done all the tests, blood tests, whatever can be tested from a blood sample. Then, after going to the hospital next day, they admitted the person, and even after showing all those reports, they again tested everything. The same tests they did again, and costed a lot of money to me, even after showing the same tests which were done one day ago. But they did them again, and they added the bill to the final summary. So this is the case nowadays, that they don't want to see the tests done by someone else. They want to do them by themselves, whether they are right or wrong. They'll do.
Yeah, that I've seen that happening. Okay, so we've almost reached the end of the session over here. The feedback that I have for you is just pay a little bit of attention to the subject verb agreement. When I say mother, that's a singular word. So it should be mother tells me. And
Okay.
it should be, it cannot be I can't remind, it should be I cannot remember.
Remember.
And that's it from my end. Do you have any thoughts and questions?
No doubts.
Okay. Well, I'll take your leave. Thank you so much for joining.
Okay. Thank
And
you.
have a wonderful evening.
Yeah.
Bye.
Sure. Okay. Bye.